Hello, everybody. Welcome back to episode 12 of our series. And wow, what can happen in 2 weeks? I want to welcome back Donna Berger, shareholder at Becker Law Firm. Donna, welcome.
Thanks so much. Happy to be here.
And we had unbelievable registration for our event today. We had over 800, and we have so many questions coming in. I've asked my partner at Castle and our president, Craig Vaughn, to help us out to field the incoming questions. And what he'll do is, obviously, it's very difficult to answer the specific questions or the specific geographic context, but he'll try and bundle those and send them to Donna and I as we go through the program. Just a couple of reminders for everybody. We're doing these every 2 weeks. Donna, we may have to go back to every week if things change like this.
We might.
Next episode is July 22, and we do have a lot of requests for past episodes. They're all at casagroup.com. And I will tell you, someone asked us, are people viewing those on the website? And we're having 300 and 400 people also watching it after we've done it, Donna. So I think it's a good thing we're posting them. And again, sometimes we get some calls about technical difficulties. The ultimate Zoom fix is to log off and log back on again, very sophisticated remedy. And then finally, in terms of housekeeping, again, Donna is so generous with her brilliance and is an attorney. And I know, Donna, you have a lot of your clients on this webinar, but we also have many that aren't. And so you're giving us your brilliance, but not your advice. And one other thing I want to mention, we do have people participating today from Texas, the Southeast, and even Canada. And Donna is, of course, a Florida attorney. But I will tell you that the principles that we talk about in terms of how we deal with our communities, I think they're mostly universal, other than the regulations. And with that, I wanted to outline the agenda for today. But before I do, we had a very, very sad loss in our industry, in our community this last week with one of the two founding partners of Donna's law firm, Becker, which was Becker and Polikoff. And Donna, you and I were reminiscing that we attended Gary Polikoff's funeral several years ago. And then this past week, Alan Becker passed away. And he was such an icon for our industry. And I know a lot of our listeners may not appreciate exactly what he and Gary did for our industry. So just take a minute and kind of share with our audience what Alan did for us.
Yeah, and thanks so much for mentioning that. Listen, it's a huge loss for our firm, but for the industry, as you said. Alan was started at 26. He was one of the youngest Florida legislators at the time. He and Gary, basically, nobody knew what community association law or condo law was. That wasn't even a thing before they started driving around in their car and representing owners who were having problems, who were experiencing construction defects in new buildings. And really, that's how that started years and years ago. And since that time, Alan went on to do many, many things. He's served with numerous governors on advisory panels. He even helped write community association law for the Czech Republic, of all places, which is why we had an office at one time in Prague. So it was a huge loss, and it was strange because the funeral yesterday and the Shiva as well were all by Zoom. So it's a new reality, and it's what we've been talking about these last 4 months, is that life goes on, but life is a little bit changed. But thank you for mentioning Alan. He did a lot for this area of law.
Well, thanks, Donna. May he rest in peace. I also wanted to share with our audience, you've been so kind to respond to our live polls. And since we've been starting that, we're starting to get some trends. And I thought you would be interested. If you view your screen, you can see our 3-week trend, and we'll keep it going. In fact, our polling today, we've decided to keep some of the questions constant so that we can see these trends. But obviously, the pools, not surprisingly, are opening up. The face mask requirement, notice it went down and then it went back up again. I think that's a reflection of this surge and our realization that we're going to be wearing masks for a long time. The gyms are starting to open. It'll be interesting to see what happens next week with that. And then finally, the clubhouses or common areas, these interior spaces are really tough to get open and follow CDC guidelines. So thank you, Mariness, for sharing that. The other thing we're going to talk about today is the update since 2 weeks ago. We're going to do another lightning round with Donna. And then a lot of your questions were centered around either challenges in reopening or should we reclose? And so we're going to talk specifically about those two things. So you're welcome to, I see the questions are coming in now. Craig, you got them. Yep. And please understand that it's highly likely we may answer your question, but not your specific question, just because there are so many and we're trying to get our answers to apply to as many people as possible. So with that, I'd like Mariness to ask our first polling question about what type of community you live in. And again, audience, thank you so much for participating. It's very helpful for everyone else that's participating, so they get to know who's on the call.
While they're answering, James, I just wanted to mention with that facial covering blip down, blip up, and I know we're going to be talking about it, we've got county orders now that are requiring and specify facial coverings be worn inside condominium and cooperative common areas. And that's the first we've ever seen of this. Up until now, those orders have not specified an association's common areas with regard to facial coverings. So I would expect as we continue and while those orders are in place, that trend's going to go even higher, because there are associations, depending on their geographic location, that are absolutely required to have residents wear facial coverings while in the common areas.
Well, it's a great point. And, that was one of my lightning round questions last week. But I think the answer to that is any time. I mean, first of all, like I know in Texas, Governor Abbott, he mandated masks statewide. I know DeSantis has not. But a lot of our board members who are listening are looking for guidance. Donna, James, Craig, what should we do? And one of the things we look to for guidance is other communities, other counties, other states. Even if it's not mandated by regulation, it doesn't mean it's not a best practice. So here, please share the results if you haven't, Mariness, so our audience can see. So there you go in terms of who our audience is. More condos than HOAs, and obviously we wouldn't expect 55 plus to be equal to the not, but really a large number of adult communities, 55 and better, Craig, you call them, ever since you turned 55. But thank you, Mariness, for that. So let's talk about the surge. The numbers are just mind-boggling. I can't even process, Donna, how crazy they are. Over 200,000 cases in both Florida and Texas. In terms of regulation, Donna, you wrote a letter last week 2 weeks ago to the governor, encouraging him to extend the emergency orders. So he did do that at the last minute.
At the very last minute. He always keeps us waiting, but he did. And I'm so grateful he did, because now the emergency, the state of emergency is in effect for another 60 days, which means that the statutory emergency powers are still available to boards.
Yes, so audience, there were a lot of questions that came in between last 2 weeks and now was, what if he doesn't? And so Don and I talked about that yesterday morning in preparation for this webinar, and we just prayed that he in fact passed it, because it was going to get ugly. And therefore, for this webinar, we won't address that. The emergency powers are in place, and that's really, really powerful for our boards to make decisions, set policy, and create a safe environment for the residents. Also, Donna, the eviction foreclosure laws were extended. Tell us a bit about that.
So there is some confusion when people, the governor did extend until August 1st the moratorium on evictions and bank foreclosures. It's important that your residents understand that association foreclosures are not impacted by that moratorium. So you've got people who may feel that they don't need to pay their assessments because of the moratorium that the governor issued. That moratorium applies to bank foreclosures and to landlord evictions. It could apply to an association if an association owned a unit and wanted to evict a tenant from a unit that the association owns. But other than that, it's really business as usual as it pertains to paying your association assessments. So if we've got owners listening or we've got boards that want to disseminate this information, let your people know that they still need to pay their association assessments. And I would only circle back really quickly, James, on the emergency powers. There is some confusion out there because of the DBPR's orders that originally said, yes, these powers are in place and they apply to a pandemic. And then later the DBPR said they no longer are in place as of June 1st. So you may get some pushback. I know I've gotten letters from attorneys representing owners who are complaining that they can't do certain things or things are closed or they still can't do their construction project. And the pushback I'm getting from those owners' attorneys is, you no longer have emergency powers. My response to that is, yes, we do. As long as there's a statewide state of emergency, the statutory powers apply. And there's considerable debate in the legal industry whether or not the DBPR had authority to issue either of its orders, but they did. It's unfortunate. But speak to your association attorney and get a legal opinion about the status of your community's emergency powers.
And Donna, I think that there's, just to reiterate for our audience, what that means as a board in terms of, can they call a quick meeting? Can they do it without proper notice under these emergency orders?
Yeah, I mean, yes, you should be having meetings. Right now, the emergency powers allow you to call meetings with as much notice as practicable. I don't know of any boards right now, because in the Tri-County area at least, that are not holding meetings virtually. They're all holding meetings virtually. Yep. If you need to pass something quickly, I could say to you, James, if we're on the board, let's meet at 10 o'clock tonight. We'll meet at 10 o'clock tonight. We'll pass this rule and we'll get it out there. You can always ratify at a future meeting as well.
Okay, and Donna, you are the chair of the Florida Bar's Pandemic Task Force. Has anything come up in your meetings that you wanted to share with the audience or issues that will be tackled?
Well, I want to say my committee, and it's comprised of some excellent attorneys throughout the state. I'm very grateful that they gave up their time to help address this in the statutes. So if this is continuing, or God forbid we get something else in the coming year, the statute will be clearer. The 718, 719, and 720 will be clearer about what boards can do, and we won't have to wait with bated breath for these executive orders to come out. What we tried to do, James, quite frankly, is to put in the statute the tools for some of the challenges we've seen over these last 4 months. Can a board legally shut down access to the building to non-essential visitors? Can a board shut down amenities? Can a board hold membership meetings electronically? So we basically made a list, and it's the same analysis that I ask my boards to do when they're considering passing rules or amendments to the documents. Is first lay out the problems, okay, figure out where the problem spots are, and then we draft to address those. So that's what we've done. We submitted our work product, and now it's just, cross your fingers and hope that the Florida legislature agrees that boards are worthwhile and they need these tools, and that this gets passed in the 2021 session.
Excellent. Okay, Mariness, I'd like you to put up poll question 2 and 3. And Craig, maybe while people are answering, is there a question that's come in or a group of them that you would like Donna to address while people are polling?
Yeah, we're getting a couple of things. One, Donna, you commented on meetings. There's a bunch of questions on can we still have board meetings and all those things. And I think, excuse me, you answered those with an emphatic yes, you should be having meetings, and there are tools, to allow you to conduct proper meetings. There are a lot of questions on masks and the confusion around, do I have to, shouldn't I? enforcement. I think we're going to talk about those later, but did you have some initial comments on that?
Yeah, two things. So Broward County this week issued an order that specified that if you live in a Broward condo or co-op, because it's really multifamily buildings, but it'll apply to HOAs as well, residents have to wear facial coverings when they are in the common areas in an association. We haven't seen that up until now. And what makes the Broward order unique is it says you have to wear the facial covering even if social distancing can be accomplished. So they don't care. You could be 20 feet away from the next person in the clubhouse or in the corridor. According to the Broward County order, you have to have that facial covering on when you step outside of your door. Now, Palm Beach County also referenced interior areas and common areas, but it said you have to wear the facial covering when you cannot achieve social distancing. Little bit of a nuanced difference. I will say it's terribly important for our people listening to know what their order says. There's a lot of confusion, and these orders change. It's very fluid. So you need to be working with management, with your attorney, to figure out what's the status of the latest order. And I think, James, you said it at the outset, that just because, you may be in Texas, you may be in the Panhandle, your county may not have the same language that Broward County orders does, but you may think, you know what, that makes sense for us. We're 55 and over, or we have a vulnerable population, and we're going to, as a board, implement that same requirement that we want you wearing a facial covering whenever you step out of your door, whether you can achieve social distancing or not. So these are the conversations you need to be having when you're trying to implement these protocols.
And Donna and Craig, what I like to leave our audience with is, Donna's giving us the legal, and Craig, from a practical point of view, I'd like to get back to just principles of how we should operate. And the bottom line is, if you're out in the open and not near anybody, you don't need to wear a mask. And if you're near anybody or you're inside a building, you should wear a mask. And I just don't think it needs to be that difficult. And that's a very defensible policy. So, and I know most of the buildings that we manage, Craig, that's the principles they're following. Obviously, they're located in a bunch of different counties, but the bottom line is HOAs, that you're living in your own home and you drive in your car, you don't need to wear a mask. But if you're going to go to a common area, a clubhouse or something, you got to wear your mask. And then obviously in the condos, when you come in the door, you put your mask on. Simple as that.
But James, I would just jump in here. It depends on what, DeSantis has not issued a statewide facial mask requirement. I believe Abbott has in Texas, that when you're out and about, even on a street, you're wearing a mask. It's in Miami-Dade, you may have a homeowners association where you're out walking your dog. You may need to have a mask on walking your dog. This is how complicated this has gotten, because there's very little uniformity. So you need to know which county says what and what your state says.
Excellent. Okay, Mariness, will you share the results for poll 2? So here we are, our HOAs, we have 49% of pools open, and we got 21% of gyms and 12% of clubhouse. Craig, do you have last week's numbers? Is that pretty comparable?
I do, and they're very, very similar. There's been a bunch of questions around, have people walked it back? We're going to talk about that after, but we're looking at about the same percentage in all three of those areas: pool, gym, and clubhouse from an HOA standpoint.
Excellent. And then, Mariness, please show the results for the condos and HOAs. There you go. And we hope, audience, you're enjoying seeing these numbers, because a lot of your questions are, what are other communities doing? And I know these are very high level data, but I think it's directional. So there we go. We've got condos, 64% of pools, gyms, 36, and common areas, 16. And Craig, does that line up with 2 weeks ago?
Interestingly, a few fewer pools, which is interesting, fewer gyms, and more common areas. So, but not materially.
Excellent.
From last time.
Okay, I want to jump into our lightning round shortly here, Donna, but one of the things that struck me, and I've had to address this with our teammates at Castle, is I think we need, as a industry, as a community, actually, I guess as a state and country, we need to get out of the mindset that this is some temporary phenomena. Florida and Texas have certainly proven that we left on our own devices can't get this thing under control. And therefore, it will take a vaccine to end it. And a vaccine, realistically, is 12 months away. So I've been coaching our team, and I guess I want to have a discussion for our audience that we should be thinking more than the next month's policy. We need to think, how are we going to run our community for the next year living with COVID? And that has all kinds of implications, including budgetary, which we'll talk about in a bit. But my point here is I think that we should really flip from next month thinking to next year thinking. Donna, do you have a comment on that?
I think in the communities where the residents have confidence that the board wants to open things and get back to normal, but as you're saying, there is a new normal here. They're more understanding of the process, okay? There is some sort of an us versus them divide that somehow the board doesn't want to open things in certain communities. I will tell you from my own experience, in some communities, the board wants to be using the pool more than anybody else. So it's not, I would say overall, people have to stop making assumptions. Ask the questions, attend the meetings. What is your intention here? If those questions are asked, I think most people will find that what's happening is boards just want to do the right things to provide a standard of care that's a heightened standard in the midst of a global pandemic, particularly in states like Texas, Florida, Arizona, where we've got numbers that are exploding. You know, I know your tagline is Castle, and it's great. And, you know, there's a line of cases from the 4th DCA going back to the 70s and early 80s, Sterling Village and Hidden Harbor v. Basso. And those cases stood for the premise that a man may consider his home his castle and himself the king, except when you live in shared ownership community. And then you have to yield sometimes. So you have to yield to the greater good. And I think that is part of the tension here, James and Craig, is that we're not understanding that you're going to have to yield. And to your point, James, you're probably going to have to yield until a vaccine comes out. We're not going to be living in a state of emergency forever. That's what I tell people. We will not always be under a state of emergency. But while we are under a state of emergency, you need to be more patient with the process.
Yes, you know, you and I laughed about this yesterday because we called the Casa Group 30 years ago because your home is your castle. And really those cases you reference basically tell us our home isn't our castle.
It is inside your four walls.
Only inside your four walls.
Yeah.
So, but I think that is what we're battling as boards. We have residents who go, hey, I own here, I'll get to do what I want. And we're going to talk a bit in a minute about enforcement because they don't get to do what they want once they
don't
go
own the elevators. They don't own the corridors. They own 1/50th or 1/100th. So they have to take into account that they are actually walking on other people's property as well.
Yeah.
If I could just interrupt for you a sec. We are getting some questions. We didn't pose the pool, gym, common area question for over 55 and better communities. I didn't know if you were waiting on that or.
I wanted to keep my my 55 and better on the edge of their seat for a little longer, but Craig, why don't we have Marinus put up poll question 4?
And then there just are, again, continued questions on to your point, you know, what's going on in the world, if you will, and the kind of common sense mask type things. I think we've hit on all of that.
Well, would you like me to touch briefly? Listen, if you still have everything closed right now, which I think we have very few people who have everything closed, but if you have everything closed, is it reasonable to keep it closed? Absolutely. We're in the midst of this pandemic. The state of emergency has been extended for 60 days and our numbers are out the roof. So if you've got everything closed, that's easy enough. You have to think about yourself answering, again, getting back to answering in court or answering in a deposition. Well, you kept it closed for 4 months. Why did you open up when your numbers were higher than back when you closed it? So that's an easy question. The more difficult question is, if you've opened it, do you close it up now because you're watching the news and the numbers are exploding? And my answer to that would be, how well are you managing it right now? Okay? If you've got low density in the community, you don't have a lot of people in residence, you don't have a lot of people at the pool, you've taken all the proper steps, everybody's behaving, furniture's being sanitized, people are socially distanced, then you probably, if you're managing it well, you can probably just keep managing it well. But if you've identified problems over the last couple weeks since you've reopened, and we've got these numbers going up, that may be the time you want to pull back a little bit.
Yeah, and I think that's a big question on the minds of our audience today, Dawn, is should I reclose? And I think that that's a tough one. I think if you have an infection break out in your community, that would be a good reason that the answer would be yes. Or if you've got the wild, wild west going on because your residents just are not complying, they may be forcing you to do that. But I'm going to jump back into that when we get to enforcement, because one of the things you can do is close amenities if you don't get compliance. But first, I want to keep my 55+ audience happy. Mariness, will you please share the results of the last poll question? So here we have, not surprisingly, less amenities open. And Donna, this is exactly the kind of good thinking our boards are doing. Mm-hmm. Our 55+ communities, which a lot of them are 75+ communities because they all bought 20 years ago, they're a high risk community and shouldn't be opening at the same rate a younger community would be or should be.
It's a very significant factor. The risks, the vulnerability of your resident population is a huge factor when evaluating what you're going to open and how. By the way, I have to tell you something, and this may surprise some of our audience, but are you aware that the portion of the governor's order that said if you come from New York, New Jersey, and Connecticut, you have to quarantine for 14 days, that hasn't been overturned?
It still
as
exists.
Incredible as it is, I just had this issue come up yesterday. We're now the epicenter, but technically, people coming from New York, New Jersey, and Connecticut in hotspots, if they come down here, they're supposed to be quarantining for 14 days. And remember, we talked about all along that some boards may and have implemented protocol that says wherever you come from outside the state, you come into our community, we want you to refrain from using whatever's open, whatever your amenities are open. You may want to have people who come from out of state not use those amenities. I'm not going to use the word quarantine because quarantine is a very strict lifestyle. You don't go in and out for anything other than a doctor's appointment. So I wouldn't go so far as that, but I do think it's reasonable, particularly if you're in a hotspot yourself, like Miami-Dade, Palm Beach, Broward, and a few other spots throughout the state and other states. You may want to say, if you're coming into the community from elsewhere, we just don't want you to use the open amenities for a few days.
I think that's a good policy. Okay, Craig, I'm going to just address one more thing, and then I would like to ask you about the questions coming in. So if you can have a quick look there. Donna, one of the things that struck me in preparation for today was we laid out a framework for opening and closing plans. And it was very much centered around, obviously, CDC guidelines, regulation, the physical plant, the demographics of your community, the staffing levels that you have available. And I think that it's a good message to our audience that plan may have lapsed because we were getting better, but that plan is still highly relevant, maybe should be readdressed and updated. And then, of course, always approved by the board and council. Any comment on kind of updating the plan in a community? Because I think if we have a very specific policy and plan and communicate it, it is easier to enforce. I'll stop there.
Somewhat easier to enforce. I'm sure we'll talk about enforcement. Look, folks, it's critical that your board be meeting weekly, okay? Weekly. You're watching the news. I assume most of you are watching the news. You're seeing what's happening. It's critical that you be meeting. You can do it easily on Zoom. Even some people are just using the good old-fashioned conference calls. but you need to be addressing the situation. How, for the amenities we've opened, how are we doing? Have we had anybody that's violating it? If we do, what are we going to do about that? Are we going to send it over to the attorney for enforcement? Do we contact the Department of Health? Do we have active infections? You cannot go to your monthly schedule. 4 weeks in COVID time is like half a year in regular time. So it's critical, James, that they do continue meeting. And as you said, the communication, the more your members have communication from you as to what's going on, the more your likelihood of being able to enforce increases. So this is not the time, folks, to be assuming or making assumptions on anything. Don't assume that because you live in Miami-Dade, you've got the same order as somebody living in Collier. Don't assume what your orders say. Don't assume what the state order says. Ask. Reach out to the proper professionals and experts and find out what the status is, and do that on a weekly basis. You probably have to be putting your foot on the brake and letting up, as we go here every week.
Well, it's funny, I'm going to jump to one of my lightning round questions I had for you, because you led to it, and that is, we're getting a lot of questions about how often should I communicate to the residents? So my lightning round question to you is, no context whatsoever, Donna, how often should we be communicating to our residents?
Minimum weekly.
I agree. 100%.
Want to do it a couple times a week? That's fine, but minimum weekly.
Yeah. Craig, what are you seeing on the question board there?
A couple things that one you commented on, and we're getting a lot of, we had a protocol, we communicated to the community when we had a positive test. We kind of went, we didn't have a whole bunch, so that all went silent. Now I have a new test in my community, I have new people. Should I be communicating to the residents where we're at?
Absolutely. Every time, it's not good enough, in my opinion, to, let's say 5 weeks ago have communicated an infection, and now you've had 3 since then, but since you communicated 1, you're not going to communicate the others. Every time you have an infection, again, we can go through the groundwork, which is don't identify, unit, floor, what name, any of that, but we have another confirmed infection, and you reiterate your protocols. It drives home the serious nature of what we're dealing with. And again, they will know, oh boy, now we've got 3 infections in here. Maybe I really do need to wear my facial covering. Maybe I don't want to use the pool. Even though the pool may be open, people need to make informed decisions. You don't want a resident to ever come back to you down the road and say, I felt safe. We had an infection 5 weeks ago. I thought that was probably cleared. If I'd known we had 4 infections since then, I might not have used the pool or the gym. So that's why you want to make sure when you have them, you let people know in the proper manner.
Yes, and I can tell you from the management side, Donna, we're really, once we know there's an infection, the interview process, and we've even used our video systems in our communities to figure out who was with who, so that we can basically contact, trace, and get to the people who may have been exposed quickly. But that's more at the granular level. At the community-wide level, the answer to the question in almost every case is, the answer is yes, you communicate. But one good distinction, Donna, and that is you don't communicate speculation, you communicate facts. And I know we've had some of our communities say, we think maybe someone said, and that's, you could be doing that all day long. So
right, there's 2 sources of credible information when it comes to an infection. The infected person told you himself or herself, or the Department of Health has contacted you. But really, another troubling thing here, guys, is that contact tracing may eventually fall completely on the shoulders of communities. We've heard in Florida, counties are not allowed to do contact tracing. Only the Department of Health, the Florida Department of Health, is supposed to be doing it, and that's statewide. And that's just not happening on any sort of consistent basis.
Craig, I see some more questions coming in about meetings, and I think that one of the things you and I, Donna, discussed yesterday, how many meetings does a community have to have? And I ask that because, we do get some complaints that our boards aren't meeting enough or aren't keeping the residents informed enough. So maybe just have a quick discussion about the requirement to have meetings, and then of course I always love your opinion on what is a best practice.
So you've got to look at your documents, your bylaws and your articles. In some sets of documents, it requires monthly meetings. It says right there in the articles of the bylaws, the board shall meet monthly. If you have that and you're not meeting at least monthly, you are technically in violation of your documents. You leave yourself open to potential complaint. In other associations that don't have that language in their documents, again, this is not business as usual. So you really need to be taking into account how you're handling this situation. You can't just have one board member tack up a new protocol on the board. The board needs to have met and discussed that. That is your safety net. If we have any board members that are doing that unilaterally, I would urge you to start having those meetings. Now, in some communities, we're in Florida and we're in July, they're seasonal. So a lot of people have gone back up north. And sometimes we've got boards where basically they have a summer set of rules, right? I'm sure you guys know this, which is we don't have meetings during the summer. Nothing really happens in the summer. So we've only got, Ed is down at the building. Ed will take care of everything. You may have passed a resolution saying that Ed is going to do everything. And you may want to rethink that resolution right now because it's nothing's going on down here in the summer. There's a lot going on.
Interesting. I want to ask another lightning round question, but while we do, we were curious, and I think our audience will be curious, whether any of our communities have yet reclosed any amenities. So I'd like Mayor Ness to ask question 5, and this is doesn't matter what kind of community you live in, so this is for everyone to answer, please. And Craig, while we're doing that, have a look at what else there is. While Craig's doing that, Donna, we have several questions came in during the week about how do we pay for extra costs that we're having to incur as a result of COVID? And that could be everything from do I need to amend my budget this year? Should I put a COVID-19 line item in my 21 budget? And we're already starting our 21 budgets. And or do I need a special assessment? So Donna, how do we pay for extra monitoring, extra cleaning, whatever the costs are of this pandemic?
So for those communities that do have fully funded or even partially funded reserves, I'm sure they're breathing a sigh of relief because those are funds they can tap into for these extraordinary expenses so long as they obtain the proper membership approval, okay? But those folks, we've always said that if you have some reserve funding, you're going to be able to better weather the storms, okay? And this is certainly a storm. So reserve funds, as long as you get membership approval, in our condos, in our co-ops, in an HOA, you may have a catch-all type of reserve that was not created by the developer that the board can use. Get your legal opinion as to how you tap into reserves. If you've got reserves, that's one source. If you don't have reserves and you don't have a line of credit you can tap into, then you're looking at a special assessment, the two dirtiest words in community associations.
Don't say it, Donna.
After COVID-19.
After COVID-19, another bad word. I've actually recommended, guys, that for boards who are under tremendous pressure to open amenities, or to maybe you've opened them like 2 or 3 days and your people are saying we want 7 days and we want 8 hours a day, I would say to them, I've been really urging associations to put it back on the residents, to survey them and say, are you willing to pay a special assessment to pay for the necessary cleaning and monitoring for this? I can't tell you how often people want something, but they don't necessarily want to pay for it. And certainly for 2021, the budgets are going to have to take into account 2 things. Going to have to take into account COVID-19 and other types of emergencies that perhaps we didn't think about in the past, and also have to take into account that your bad debt line item might increase as a result of the economic impact from all of this. So if you've traditionally had like a 2% bad debt line item, that may need to go up.
Okay, Mayor Ness, please share the results of have you reopened any amenities? And you can see that we had very few, but we did have some. And I think that segues nicely into enforcement, Donna. And this is, Craig, it may be the biggest question on the board we get is, how do we deal with our owners who aren't complying? So what are some tools our boards have for enforcement, Donna? And let me just begin by saying, I think the weekly communication, and that can be, that could be by, your mobile app or your email or posting, but communicate. And we've said all along with violations, even if you're in an HOA and roof violations, we'll send out a message to our community saying, we're going to inspect roofs in March, so get them cleaned, and most homeowners do. So beyond communicating well, what are the tools in our tool belt as a board to enforce these COVID regulations or policies that we're creating?
So there's a couple things you have to take into account. One, a COVID violation is not a trivial violation. This is not the same as parking in the wrong spot, having a commercial vehicle. These violations of your COVID protocols can result in people getting sick and even dying in the worst case scenario. So you don't go back to your same old tools that you would use. You don't have the luxury of time that you would ordinarily have with other violations, okay? They have to be met consistently and speedily. And I will tell you, it has been my experience over these last 4 months that it takes one attorney letter to cure more than 95% of these violations. When they get that letter from the attorney saying, you are potentially putting people at risk, here's what we're going to do to you. By the way, if we have to move forward with an emergency injunction, it's going to cost $5,000. I put that number right in there. That's what it's going to cost, is $5,000 if the association has to get an emergency injunction. And by the way, we will be seeking our attorney's fees and costs from you if we prevail. Now, given the landscape we're in, do I think a judge will grant an emergency injunction for somebody who is violating the COVID protocol and violating a local county order? You betcha. So it really just takes associations having the confidence to know that they have to do this, and they probably only have to do this once, maybe twice. Here's the other thing. If you only have one bad apple, that's the way you go. If you've got a dozen bad apples and you don't want to keep doing that, you shut the pool down. You have to shut it down altogether. So it really is, are you dealing with one violator or do you have a handful? If you have a handful, rather than going after emergency junctions after 12 people, you're probably better off shutting down the pool again, or the gym, or the clubhouse, or the tennis court, or anywhere these violations are occurring.
Well, just to that point, one of the recommendations you've made in the past is even suspending the right of the violator for the use of the pool or the amenity is another remedy we do have in our tool belt.
If you've got a fob and you can shut it off, and I'm not talking about a 14-day notice to this person's violating the pool. You've got a pool fob, talk to your attorney if you've got the ability to shut it off. But I wouldn't do that without having the attorney write to that person and saying, this is what we're doing.
Okay, so I'd like to, we have a lot of questions coming in, Craig, about access to the community. So Mayor Ness, would you put up in sequence 6, 7, and 8, and this is just by community type, whether you're allowing access to your community.
That's a good one. James, while they're answering this, could we go back to the reclosing, the question on the reclosing of the amenities? So yeah. I get asked this a lot as well. Let's say your association's in Miami-Dade, right? And Miami-Dade is now closed bars again. It's shut off dining inside restaurants. It's shutting down the beaches. It's really pulling back altogether. If you can, do you have to close your community pool? No, it doesn't say that right now, but you have to think about it this way. If you are in a geographic location where your city or county is closing things, and you haven't been ordered to close something, but you keep your amenities open, do you know what you've done? You've made it easier for plaintiff's counsel to tie the source of infection to your amenity. Because if people weren't eating out in restaurants because the county closed them, if they weren't working out in gyms because the county closed them, if they weren't going to the beach because the county closed them, but your beach, your pool, your gym were open, what you've done is you've just made plaintiff's counsel job easier because they can eliminate everything else that the county closed and they are looking straight at what you kept open.
Oh, that's a good point. That's a good point. We have, if you live in a condo, we have the access questions up. And I don't know whether you can do it at the same time, Mayor Ness, but what about the HOA? Can you share those results at the same time? That could be a no.
I did get a look at the results. I did get a look. You'll be, I think, really surprised by the relaxing of those rules when we show them. So we'll talk about that a little bit, maybe.
Okay, so with respect to, we've got some questions here about the pools and cleaning protocols. And Craig, maybe you and I can take this one on. Obviously, there are some CDC guidelines, excellent, on cleaning, but what we have found in our communities are cleaning frequencies should be established based on the usage of the amenity and the availability of staff, and tie that to the opening. By the way, the 55 plus is up there now, sorry. And tie that to the opening hours. So you do have to marry, are you gonna open? Can you monitor? And do you have staff to do the cleanliness? But there are so many different communities on this call. It's not like we can say it's every hour or every 30 minutes or twice a day, but it does have to be reflective of the variables that I just mentioned.
Yeah, I think I would agree with that, James. And I think the equally important is you have a plan, you communicated it, you need to execute it. Like you're in, if you say you're gonna close down the pool half an hour every 2 hours to clean, close it down, demonstrate that you're cleaning it, sign it off so that everybody knows. I think we have the best laid plans, mice and men, and then we have where the rubber hits the road. And I think you can only get yourself in trouble if you don't execute on what you said you were going to execute.
Good point. Okay, Mayor Ness, please share the HOA access to the community. Now these are very high. Keep in mind, in an HOA, it's very easy for a contractor to come in and drive to someone's home and do their thing and get out. So I'm not surprised that these are high, but Craig, are they materially different than previously?
Yeah, 50% higher. Contractors visiting HOA 2 weeks ago in the poll were 63%, and now we're 94, 57 versus 87 now, 76 versus 91, and 66 versus 68. So that's pretty close, but really a relaxing of the rules with respect to access.
Okay, so let's put up now the condo ones, but I mean, this is one of the reasons, Donna, I think we have a spike in cases is because we're opening up our communities. And
so listen, in a condo or co-op, which is typically a multi-family building, 89% are allowing contractors, 91% are allowing realtors.
Yeah.
Listen, I have to tell you, James and Craig, if I was going to be mapping out how to be reactive to what's going on with our numbers and local orders, rather than shutting down a pool, as long as I'm managing the pool well, okay, I probably wouldn't shut that down. But what I would do is look at these protocols, the guest visitation, and say, can we shut this back a little bit? Because we've got more people coming in right now. You've got more people coming into these communities right now than back in April, and our numbers aren't even close. Our numbers in April were not a tenth of what they are right now. So we're almost working counter to what we should be doing, which is we didn't let anybody in when the numbers were quite small, and now we're letting everybody in when the numbers are catching fire. So if I was going to make a suggestion, I would say maybe you don't have to eliminate it, but how many, are you limiting the size of the construction crew? How many units are doing this at one time in your building? A lot of these communities are seasonal, so you've got the owner who lives somewhere else with a large construction crew going on right now, and it's impacting the people who are still in residence. Also, if we go all the way back to a shelter at home, you're really going to have to rethink this, because you can't have that going on when people are stuck in their houses.
Okay, Meredith, show the last one for the 55 plus, I think, is the, there you go. And the one thing, like I live in a high-rise condo and we're not allowed to have guests, and everyone's, complaining about that, but this goes back to our new normal. We're used to having everyone over for the barbecue, enjoy the pool, and that's not the way it's going to be for a little while. But Actually, Craig, these numbers are pretty high too, even for our adult communities, but they're much more HOAs. So I think that may explain that. They can have.
I mean, I wouldn't have expected to see, like, again, a 50% increase in the numbers over really a 2-week period. So it's a real, you're almost back to normal, right? 125 or 132 associations are letting anybody from a contractor standpoint in. So you're really back to, even though we have a new normal with respect to what's going on, we're back to normal with respect to who's getting access to our communities.
And again, those are the entry points that people will be looking for down the road, which is, who had access to the community and how often. Look, in a single family homeowners association where your contractor can come, drive to your driveway, get out, and the only person that they're impacting is that homeowner, that's one thing. But if you've got construction going on in multifamily buildings where you've got people accessing the corridors and the elevators, that becomes more of a risk. I mean, we've got county orders saying you have to wear a facial covering, for instance, in Miami-Dade and in Broward, and anytime you step out of your unit. So think about what you're doing. You're actually bringing other people in. It's risky.
Yeah. Okay. You know what I think I'm going to do, Mayor Ness, is put up the last 3 poll questions, and we can talk while people are answering. But it's about masks, and we are getting so many questions about masks. We might as well let you know what other communities are doing, and it's going to go HOA, condo, adult again. And Craig, while we're doing that, can you have a quick look at the questions and see if any of them are congregating like common questions? And then Donna, we're running out of time as always, but I do want to talk about risk management and liability management before we let our audience go. So Craig, while they're polling, what is our question and answer board showing us?
Well, I think your comment on risk management is a big one. We're getting a bunch of questions on signage and waivers. Should we be using waivers to minimize our risk when people are using the pool or amenities? So that was one. A couple of questions on signage. So maybe you could address those types of things in terms of risk mitigation strategy, Donna.
So signage and waivers might make your board feel good, but they are not going to insulate you from potential liability. Certainly new signage in terms of the sanitization requirements in common areas, whether it's the pool, whether it's a shared laundry facility, you're going to want to put signs up telling people what's expected. In terms of they need to check in and show that they're residents because you don't want guest usage. Those kind of informational signs, absolutely. But the signs where you think that you are shifting liability from the board to the owners, it's not happening. Courts disfavor those kind of releases. For instance, you could say you got to sign a release or you can't use the pool. In a condo and a co-op, the right to use the common areas is an appurtenance to the unit ownership. Okay, and I'm sure we'll have a lawsuit about this, or at least a complaint with the DBPR at some point. If you tell me I can't use the pool unless I sign a release, it's an appurtenance to their unit ownership, which is don't open an amenity if you can't manage it. And just saying we're going to try to shift liability, it's not going to absolve the association. Again, this is why I don't think many of the residents understand that there is no insurance coverage for these kinds of claims, for these bodily injury and wrongful death claims related to COVID or any kind of communicable disease. Now, some associations may have purchased separate gap insurance coverage. And James, I think we spoke to Andrea Northrup about that a few episodes back. Even that coverage, which 98% or more of associations don't have, even that coverage only covers legal defense fees. It doesn't cover any settlements or awards. So when you're looking at that, if you open the pool, you better be, or another amenity, you better be managing it. And the way to manage it is maybe you don't open it 7 days a week, 10 hours a day. Maybe you do a few days and a few hours and you've got somebody monitoring it, and you can, if you're ever challenged, you can prove the steps you took to adhere to a standard of due care.
One comment you've often made to me, Donna, is you're going to more likely getting sued if you open something and get an infection versus not opening and having an upset resident. So
Absolutely. I mean, economic damages related to I can't do my construction project or I can't have an in-person showing in my unit. We know we have a pretty good idea what the economic damages are related to those claims. But the claims for wrongful death or bodily injury, you just don't know. And you don't know how many potential plaintiffs you might have.
yeah. So Craig, I'm going to share the results. Ness, please share number 9 first. And Craig, I know we're getting some questions on collection policy, and Donna and Castle's position from the beginning is don't change it. We need the money to operate our building. Craig, what's been our experience at Castle in terms of collections?
We've had, luckily for us, we measure on a monthly basis globally across all our associations to see if we have a challenge, and then we can drill down. But we had a 1% increase from May 15th over February 15th, which was the second month in the quarter. So we make sure we get good comparative results. And we basically, we've had no change in July. It's a big month when everybody has to pay, where, some maybe worry that we've been 3 months from the last quarterly payment and here we are again, and we're not seeing a big change. So we're fortunate, I think. I think there's going to be pods of communities that maybe have a problem and have to get on this, but we haven't had that experience.
Yeah, I think that reinforces our recommendation that it's as steady as you go on collections, and that seems to be proving right. Okay, so I have here the HOA mask usage is 37%. Craig, I'm not sure how that compares, but that's in the HOA, so I'm not surprised to see that.
Yeah, I will say though, James, in that, that is, again, 50%. It was 24% when we ran it 2 weeks ago. So, by the way, the governor did, the counties have come in and mandated some masks that weren't there before. That could be part of it, but that's significantly higher. 25, it was 24% last time, 37% this time.
Yeah,
So
I'm sure that number would be higher in Miami-Dade, Broward, and Palm Beach, where facial coverings are mandated in certain circumstances.
Yeah, how about in condos, Ines? And Donna, while Mayor Ness is sharing that information, it struck me, you have recommended we relook at our documents and do some amendments to make them more effective for times like this. And those were kind of recommendations you made to do in the future, but I almost think the future may be now. Is this something we should be starting now? Because this may be going on for quite some time. And honestly, we may be able to get our residents to agree right now because it's hot on their minds.
Yeah.
So I'm just gonna.
Absolutely. I mean, amendments to the documents can make this entire situation a little more palatable moving forward. For instance, I would recommend incorporating some of the emergency powers into your documents so we don't have to wait for these orders to come out. If your community allows short-term leasing, you may want to put in as an amendment to that you can hit pause on the short-term rental activity in your community in the midst of a contagion. There's a number of different amendments I would recommend. I would urge people to speak to their association attorneys and talk about the different kinds of amendments we can put into the documents that will make this situation easier. We can actually even put in there about meetings, holding them virtually, membership committee and board meetings. I did want to circle back on, it just popped out of my head, but there was one issue that I wanted to talk about.
I'm gonna share some poll results while you rethink that one, Donna. Okay. So in our condos, we have 51% of mask usage. Craig, that looks low to me, although as our audience has reminded me sometimes, they're not all high rises. Our condos could be open condominiums and not necessarily have to go inside, but that number, how does that compare to last time?
From an absolute standpoint, it does look low. From a comparative standpoint, it was 33% last time. So I think we're starting to hopefully see, we're letting everybody in, but at least we're making them wear masks. Is kind of what
Okay, and
all right, I collected myself. I just remembered what I wanted to say really quickly.
Go, Donna.
While I'm not in favor of the releases for owners because courts disfavor them, I am in favor of indemnification agreements from real estate broker companies and contractors. These are people who are doing business in your building, in your community, okay? And if they want to do that kind of business in the midst of a pandemic, I think it's entirely reasonable to ask them to indemnify the association should any claims arise as a result of that activity. And those are companies that typically have the resources and assets to back up an indemnification. Whereas an owner indemnification is typically not worth the paper it's written on. If you've got realtors and contractors that are doing business in your community in the midst of this pandemic, in the midst of a statewide state of emergency, with our numbers rising, I think it's entirely reasonable to ask them to indemnify the board.
I think that's great advice. I know one of the ones that I don't think we addressed specifically, and I know we're running out of time. In fact, I want to share the 55 plus results. Craig, we've got 34% requiring masks, 24% no, and not applicable probably means it's an HOA, they go right into their units and not. But how does the 34% compare?
22% last cycle. So again,
yeah,
pretty consistent theme. That's a lower number, 34% of parties that I would have thought, but it's still higher than we had 2 weeks ago.
Yeah. So for our audience, because we're run out of time here, I think this will be really interesting information for you as you stay with us, because we're going to show you these trends, and you can compare that against your own community. And I know they're not perfectly comparable, but with that said, I did also want to mention there's some questions, Donna, about Realtor Access, and I think the distinction I wanted to bring out was most of our communities are allowing Realtor Access, but not open houses. Is that what you're finding as well, Donna?
Yeah, absolutely. I don't think open houses are going to be something you want to do for the next 60 days.
Okay, I'm going to give some last words here. Craig, is there anything that we missed or was burning from the questions before we sign off?
No, I think we got most of the stuff. So good job.
And Donna, as always, you get the last word except for my last word.
Okay. Well, thank you. I want to thank all the boards and managers who are listening. Nobody signed up to serve on a board in the midst of a pandemic. It's a thankless job under ordinary circumstances. I think we all agree these are extraordinary circumstances. So I do want to thank the boards that are working on this. They're working diligently to safeguard their residents. They're doing all the right things. You might not be very popular right now with some segments of your resident population. You're certainly popular with the three of us, and I'm sure there's people in your community that thank you for taking the necessary steps to safeguard them. Yes, we tip our hats every day to our boards, and too bad we couldn't skip 2020 on the calendar, but here we are. So with that, everyone, I want to thank Donna and Craig for helping us out today, and I want to thank all of you. We had a great audience today, and your surveys have been really helpful in us shaping the content, and your submitted questions, and obviously apologies if we didn't get to your specific question. And then, of course, we always love your positive reviews for Castle or Becker, and so we always leave instructions on the screen here if you want to do that. So thank you so much. We're going to be back on July 22nd in 2 weeks. We'll have some more trend data. Hopefully we can bring these numbers down. By the way, I didn't mention at the beginning, but we had almost 10,000 new infections in Florida yesterday. It was just stunning numbers, but hang in there. We will provide you all the support we can. So have a safe 2 weeks, and we'll talk to you on July 22nd. Thank you, everyone.
Take care, everybody.
Bye.